everyone who does physical therapy has to incorporate some form of psychology into everything they do. You have to be able to deal with the patients really well, and you have to be able to interact with them well, and you have to be able to just really connect with them well to be successful in this career. You really do. That's the number one thing I think you have to be able to do, is be very, very good at connecting with your patient.
Physical therapy is a branch of rehabilitation medicine that encompasses a wide spectrum of the nation's demographic. With this in mind, it is necessary to explore to what extent these patients adhere to their prescribed treatments. A common factor between the individuals that do not comply with therapy is the psychology of the patient. Many exhibit psychological issues and emotional problems, including, but not limited to, low self-efficacy, helplessness, depression, anxiety, and poor social support or activity. Therefore, the patient-therapist relationship is pertinent to the patient's success in the prescribed exercise plan. So how can therapists better motivate their patients to start and complete their exercise treatments? The best way to achieve this is to add more clinical and psychology-based classes to the graduate school curriculum. It is difficult for patients to heal when they do not complete therapy, so if they are not receiving the maximum benefit of the treatments, what does this mean for the economy? A study conducted surveys to determine if there is a relationship between musculoskeletal pain and happiness, and it seems likely that people with musculoskeletal pain are unhappy with their jobs because of their pain. In a separate study, the authors found that job satisfaction and life satisfaction demonstrated statistically significant correlations to productivity, and that happier people indeed were more productive. Noncompliance is directly affected by the psychological barriers that the patient has. These barriers all affect the beliefs and attitudes towards treatment, which therefore determine if the patient complies with therapy. The factors shown all contribute to the beliefs and attitudes towards treatment, and when negative, lead to noncompliance. The therapist-patient relationship is incredibly important, and the ability of a therapist to motivate their patient will determine the patient's healing. More focused courses in psychology and clinical experience will improve this ability. Psychology and clinical experience are very underutilized in physical therapy graduate programs. Physical therapy graduate students need to be more exposed to the psychology of the patient, for if the therapist knows the patient's barriers, he or she can better motivate them to complete therapy. So what does it mean when we put all of these facts together? In itself, physical therapy is a large expense nationally. When patients do not complete their treatment, they do not heal completely. This creates issues when they try to return to work. Workers in pain are less happy, and less happy workers are less productive. The economic burden of non-adherence to physical therapy treatments is quite large and could be dramatically reduced if the problem was addressed. Adrian Peterson is a running back for the Minnesota Vikings. 2 years ago, he tore both his ACL and MCL, but after 9 months of rehab, returned to the game he loved, stronger than ever. Adrian Peterson is an elite athlete and rushed his way back from his injury, as most patients will try to do. The opposite can be argued as well. Some patients will not move fast enough for fear that they are not getting treated to the extent that they should be. There is some reason behind this, for it has been proven that patients who do not receive the correct amount of treatment are likely to be readmitted within the year. However, therapists are very well trained and know what the right pace is for their patients to be moving at. The second opposition could be to the implementation of more focused classes into an already very stressful physical therapy graduate program, but because the model is switching from requiring a master's degree to a doctorate degree, now is as good a time as any to make adjustments. There are more options available, as Bradley explains.
I'm on the San Jose District Representatives Group, and they just brought up a motion in the California legislature to make residency and fellowship programs, so that would be your first or residency program right after college, a requirement where you would go and you'd graduate school and then you'd go into more like a medical model where your first job would be in a residency program where you'd gain more knowledge and clinical experience in your first year out.
As is evident, non-compliance with a physical therapy regimen is problematic in numerous ways. If physical therapists had a better understanding of the psychological hesitations in patients, then they would be better able to motivate their patients to do the exercises they prescribe at home. This can be accomplished by including more patient psychology classes and clinical patient management experience in the physical therapy school curriculum. Many DPT programs include psychosocial interactions classes. However, most school curriculums focus much more heavily on the physiological aspect of physical therapy, with very little emphasis on behavior sciences and psychology.
The way the PT code or PT law is set up, we could deal with kind of mental health issues, which is kind of a funny way to put it. But it just shows that there is definitely a lot of psychology that's involved in what PTs do.
Instilling the importance of understanding these behavioral aspects in graduate school is necessary to keep the physical therapist at a high level of competency in assessing patient hesitations and needs. The extreme statistic of 70% of patients not adhering to their therapy plans correlates with sources that explain that noncompliance is associated with background emotional and psychological issues and/or fears that the therapists are not including into their considerations of treatment plans. Therefore, as these 2 points seem to have an association, physical therapists should be required to be more educated in psychological areas as to better motivate and understand the barriers their patients are dealing with. The advantages of increasing a physical therapist's understanding of the psychological hesitations in patients are numerous. Patients would experience a faster healing time, which therefore would decrease time out of work, decrease pain, and decrease money spent on treatment.
I think there needs to be more clinical time. I think that's really the most important part, is being in the clinics more, seeing more patients, seeing more, just seeing more people and trying to, put more time into doing a good subjective exam on a patient, and then, doing better job of how do you funnel down to a tighter knit objective exam, and then trying to make a good hypothesis from there. And I think that's the one thing that they don't really teach you well in school, at least in PT school, at least in my program. I didn't think they did a great job of that. They give you a lot of the subjective things to ask. They give you a lot of the objective tests to ask. But I don't think they do a great job of pairing everything together and making you more efficient.
Students in school and therapists on the job need to receive more training in psychology and patient interactions. Graduate programs only spend a minimal amount, 15% for USC or 10.2% for UCSF, of their curriculum on patient interaction, while it takes up such a large portion of their effort every day. Because Bradley has his bachelor's in psychology, he is able to work well with his patients and keep their attention along with their trust. All therapists should have a similar background because he knows that the psychology degree does help with patient interaction, and that understanding the signs to look for with regard to depression and other psychological diseases can really impact the patient's ability to heal and improve. As a result, he is better able to motivate his patients to heal and improve on his schedule.